What's going on, everyone? I'm just a typical, average American here today to react and learn about Canadian healthcare. And today, I want to take a look at some Reddit discussions that are talking about what Canadian healthcare is really like. Because here in America, we have a certain idea in our mind about Canadian healthcare, that it's a better system, that it's government run, covered by your taxes, by the government. Everyone is covered. You can get care and good care when you need it without worrying about becoming bankrupt or ending up with a 10, 20, $30,000 bill if you need certain care. That's the idea we have in our mind in America, that it's a better system in Canada. And I've done some videos in the past trying to learn about how the Canadian healthcare system really works. As an American who's never participated in it, it's a little difficult for me to actually hear about real experiences. But in the past, I've heard good things about it on YouTube. But I've also heard criticisms of the Canadian healthcare system, which is really something we do not hear about here in America. But when I went on the internet, on some YouTube videos, and read about it, I saw some criticisms actually. And when you look up Canadian healthcare stories on Reddit, you come across a lot of criticism, a lot of negativity, honestly, which kind of surprised me. So I don't really know what to believe at this point, what the true story is of Canadian healthcare, and I'll show you what I mean. So in this Reddit discussion, it says, just how good is the Canadian healthcare system? I'm considering moving from the United States to Canada. One of the biggest talking points is about the Canadian healthcare system. Yes, I remember hearing about how good it was, especially when the average American, we don't get government run healthcare. Yes. However, based on some of the comments I've seen, it sounds like the Canadian healthcare system isn't as good as Americans think it is. Should I be concerned about healthcare in Canada if I were to move there? This is exactly the questions I have, honestly, at this point. Let's scroll down here. We got some deleted comments. I wonder what that means. So the first one we have is, where you're going matters a lot. The healthcare system in Canada is provincial. Responsibility, and each province handles it differently. Oh, interesting. British Columbia and Ontario historically had the best healthcare systems. Quebec historically had the worst? This is just a random person on Reddit. It's all I have to go on right now. So for the sake of arguments, I'll assume this is accurate, but I don't know if British Columbia and Ontario is the best. I don't know why Quebec would have the worst or why that would be, but COVID really devastated our healthcare in a number of ways. There's been a change in philosophy for many physicians that aren't putting in the hours they used to. Canada has more doctors than ever, but historically high delays for many healthcare needs. That's what I've heard in some of this internet talk. That in Canada, it's wonderful. You can get the care you need. You don't have to worry about affording it, which is something that really stresses out a lot of Americans. It's terrifying to a lot of Americans. Affording health care. Something that you'd think in the modern day, in a civilized society, that wouldn't be something that we have to worry about. That'd be one of the things we would make sure everybody had. Isn't that the point of a nation, a government, an organized society? You would think so. So that's a pro of Canada over America for sure. But this high delays is something I've heard about. Overall, I'd rate our system 3 out of 10. It's doing what's required, but not an ounce more. And it won't be changing for many years to come. Really? As long as you have the means to buy your way out of the national system, when the going gets tough, you'll be fine. I had a friend who was a nurse at a hospital in Myrtle Beach, South Carolina. She said every winter the hospital fills up with wealthy Canadians having heart surgeries. I guess it's like Americans going to Mexico for dental care. You can go to Mexico for dental care? No one told me about that. Anyway, this is fast. Is this true? Like, if you're Canadian and you need care, and if there are high wait times in Canada, you travel to the United States sometimes. They're saying in South Carolina, wealthy Canadians who can afford to travel to the US to have their heart surgeries in America. Because in America, it is true, if you have the money, the money, you can get whatever you want. Pay the hospital, pay the doctor. They'll get you your surgery. They'll get you your treatment. That's I guess you could say that's the biggest pro. Sorry, the biggest con. The worst thing about our system, and also a pro, because it's true in America. If you're rich, this is a really good country to get healthcare. If you're very wealthy, that is true. We have great healthcare, great doctors, great technology. The care is great. It's it's how everyone doesn't have access to it is the problem. In Canada, you need a family doctor that sees you for normal stuff or refers you to a specialist. They're like primary care physicians in the United States. Okay. There is a massive, massive shortage of family doctors in Canada. Really? The other person above said there was a surplus of doctors, so I'm not sure what the truth is. People have been on wait lists for years to find a family doctor? For years? Is that true? Is that true? Existing doctors are retiring. New medical school graduates are going into specialties because it pays more and you work less. I'm Canadian and I'm in the United States. I'm having second thoughts about going back. I'm paying a lot for my US healthcare. My bill is $600, $700 a month. Yeah, between insurance and the fees, but at least I can get my appointments. Interesting. Interesting. It's like a balance. I mean, assuming some of this is true. And again, I'm just going off of this. I don't know if it's the truth or not, or if these are anecdotal experiences that don't apply to everyone in Canada. I don't know. But assuming this is true, in Canada, sounds like everybody can get the care, but you might have to wait longer. Maybe it's because everyone is utilizing that right to get care. Everyone's doing it. There's no barrier to entry in the Canadian healthcare system. If you need help, go. And that might cause longer wait times, I guess. Whereas in America, if you, I mean, as sad as it sounds, there's a barrier to entry to getting help. You might think twice about seeing your doctor about feeling bad or an injury that you think, oh, maybe I can take care of this at home. Or, I don't want to call the ambulance, even if you fell and broke your arm. That's going to be $1,000. I don't have that. So this altogether in America might contribute to shorter wait times because Americans are not, running into the hospitals for help all the time because we know it's going to cost us. Even with health insurance, you're going to get charged some amount of money. It doesn't cover everything. The quality of Canadian healthcare is excellent, but you have to wait a long time, unless it's life-threatening. If a moose bit off your arm, you wouldn't have to wait 12 hours. Thank goodness. Thank goodness you got that moose coverage. Right, if you're dying, they'll see you quickly, which makes sense. That's how the system should work, right? Prioritize the injuries and ailments according to how threatening they are. In an older video, though, an older healthcare video I did learning about Canadian healthcare stories, there was one guy who needed cancer scans. You want to get your cancer scans quickly in a timely manner, but that was taking him months and months and months. So it's like if your arm has been bitten off by a moose, they will see you because you're literally dying on the ground. If you need scans or a heart surgery, that's gonna prolong your life expectancy, you're not dying that second, technically. So maybe you have to wait. And that's maybe the frustrating part, I guess. My bill is 600, 700. Wow, that's a lot. Yes, it is a lot. Depending on your healthcare insurance plan, if you need a family plan, sure, it's totally not uncommon to pay $600 or $700 a month for like a plan. Um, that'd be cheaper, honestly. A family plan for 700 a month would be like probably pretty good, honestly. Okay, let's jump ahead to another discussion here. Canadians of Reddit. What's your personal experiences with the Canadian healthcare system when it comes to the level of care, the wait times? This is talking about Canadians. What are your personal experiences here? Wait times can suck. The quality is pretty good, but it does feel stupendous. What a word. It's stupendous not being in crippling medical debt when I walk out of the hospital. That is until I go to the parking meter. Okay. They get you with the parking. All right. But yeah, walking out of a hospital not expecting a bill to come in the mail. That'd be quite a feeling. I'm going to be honest, that'd be quite a feeling. I'd still rather pay 300 for parking than 30,000 for a checkup. Well, let's be honest. In America, you're not going to pay 30,000 for a checkup. Um, let's say if you're giving birth in America, birth, that's expensive. The total like costs from the hospital for giving birth in America, I think are like $50,000. If you have an insurance plan, which you better, if you're giving birth, you better. If you have an insurance plan, they're going to cover, I don't know, 90% of it or something. Or so you're going to end up, I don't know, more. I don't know. You'll end up with a $3,000 to $5,000 bill for giving birth out of the 50,000 they want to charge you for. And they charge the insurance company $47,000. It's a crazy system. It makes no sense. I don't know. What a roundabout way to just charge us a couple $1,000s, and then somehow they make 47,000 from some random insurance company that I have to pay hundreds of dollars a month, even though I pay taxes. I do. I pay taxes to the American government instead of like allocating some of our tax money to, I don't know, maybe our military budget, which is already ungodly big. Maybe some of that could go towards covering my healthcare bills. And we'd call it the Canadian healthcare system. And it'd be great. You just never mention that it's like the Canadian system. Or the American government would be like, what? What are you trying to do? How will the hospital make money off of you? Wait times are triage based on when you're really ill. Front of the line, but if you have the sniffles, you're going to wait. Yeah, it's nice, I guess. I mean, I can only go off my experiences in the American healthcare system. If I have the sniffles, I can go online to my hospital's portal, online portal, schedule a doctor's appointment. I could get seen in 2 days, probably, and be in front of my doctor for an appointment if I had the sniffles. Maybe even 1 day, honestly. If you're living in a big major city, maybe it'd be tougher to get quickly seen. But if you're living in like a random part of the United States, random average city or town, you can get seen very, very quickly for whatever the heck you want. And that's a nice feeling. Level of care. I think it varies based off the staff, like every hospital. However, they have kept me alive. AB -2 year. I don't know I'm not sure what this means. It's some kind of Illness? I'm still waiting for a groin hernia surgery. First appointment with a surgeon isn't even booked yet. After 2 years? Is that what he's saying? Honestly, at this point, you might start looking into private healthcare if you can afford it. It'll be 15 to 20,000, but worth it if you can do it. No, no, not an option. Yeah. What do you mean it'll be 15 to, who has 15 to 20 grand? Wait times in the ER. If you don't have a severe or life-altering ailment, you'll wait a while. I've gone to the ER several times. I get kidney stones. I didn't know what it was at first. It just felt like a ghost was stabbing me in the back. But I wasn't dying. It just felt really bad. I guess I could have had like appendicitis and been dying. But anyway, I just walked into the emergency room, said I had really bad pain in my side back kidney area. I was seen within 10 or 15 minutes. So is that it wasn't life threatening at all. A kidney stone, they didn't know what it was. It could have been life threatening, so maybe they had to take it seriously. But I'm just saying, I didn't walk in with a gunshot wound, and I get seen in America within 10 or 15 minutes in the emergency room, no problem. You can wait 4 to 5 hours with a sprained ankle or broken arm. That's unbelievable. That's unbelievable to me. 4 to 5 hours with a sprained ankle or broken arm. What's that about? Are there just so many? Because in the United States, we have a bigger population. Maybe we're spread out over a bigger area. Canadians are very, very condensed population-wise. Very, very condensed. All 40-some million Canadians are really close together, typically, from what I understand. Is that why the hospitals are so overwhelmed? Is that fair to say? 4 to 5 hours for a sprained ankle or broken arm. I've never heard of that ever in America. That people would be angry. That'd be crazy. ER wait times aren't out of line with what American emergency rooms are. No, these are out of line. I mean, maybe I'm saying if you're in New York City, you're going to probably wait a few hours, I would imagine. If you're in a random mid-sized town or city in America, you're going to get seen quickly. I mean, from what I've experienced and who Americans I've talked to. No, I haven't experienced all of America, I'll admit. Even as an American, it's a pretty big place, so I could be wrong about that. I could be wrong. The result of people using hospital emergency rooms as personal clinics. Lady, take your kid with an ingrown toenail to your doctor or the clinic, not the emergency room. Do people do this in Canada? That would be out of line in America. If you have an ingrown toenail or a cold, you do not go to the emergency room. Is that a problem in Canada? Because I could imagine if all your healthcare expenses are covered, it's covered by your taxes. It's free, we'll say. You could just go into the emergency room for any reason if you're just feeling bad, which is good. And everyone can do it. Is that where the long wait times come from? I'm just trying to understand the long wait times. That seems to be the number one criticism of the Canadian healthcare system. That's the one. Here in America, you don't just go in for any reason because it's going to cost you a lot of money. For better or worse, maybe that keeps our wait times down. Wow. We face shortages, month-long waits for joint replacements. Yeah, I mean, everyone I know who's had needed a surgery for whatever reason. Basically, you get your surgeries scheduled 1 or 2 weeks out, 3 at most, I would say. Wow. Okay. Well, that was interesting. Again, let me be clear, this is just random people on Reddit talking about this, so it might be true, it might be accurate, or it might not, but for the sake of learning, I'm just wanted to take a look at this. I did find this very interesting, though. Very, very interesting. If you enjoyed this as well, feel free to give this video a like, or please leave a comment if you're Canadian and you can give your insight into the Canadian healthcare system. Is it good? Are there negatives to it? Are these criticisms valid and accurate? That'd be awesome to hear about from Canadians who have experience with this. And if you're interested in more videos like this, me reacting to Canada, learning about Canadian culture, feel free to subscribe for more. And until then, thanks for watching, and see you next time.